Hello, this is Dr. T from First Class Pediatric Dentistry to answer a question that I get from a lot of parents in the practice as well as patients in the practice. And that question is, what do I do? My child has a toothache, or I have a toothache, if it's the child speaking. And so I'm going to go into a little bit of that today and just some of the common reasons that kids will end up having toothaches. So before I start, I have to say this really isn't meant to take the place of any sort of evaluation or advice that you get from your pediatric dentist or your pediatrician. It's just to kind of give you some insight into the reasons that a child may be having an issue with a toothache. So I'll start by saying the most common reason that kids will have a toothache or complain about a toothache is they have a tooth that's fallen out, or what we call exfoliating. And what that means is one of the 20 baby teeth that you have in your mouth is falling out. So as that baby tooth falls out, it undergoes a process called resorption, which means that the root of the tooth is eaten away. And so you end up having just a shell of a tooth that's holding on to gum tissue. And sometimes just with normal function, you will bang that tooth into the gum tissue and it will cause a lot of inflammation being irritation, and that will end up causing discomfort. So if you're pretty sure that your child is losing a baby tooth and you see that it's loose or it's wiggly, you can always do a warm saltwater rinse, or you can do an over-the-counter pain medication. So whichever over-the-counter pain medication that you typically use, ibuprofen, acetaminophen, they're all pretty adequate. If you're not 100% sure that this is what's going on, the best thing to do is actually to go into your provider and make sure that they're able to evaluate it and see that nothing's going on. So the second biggest reason that I have in my practice that kids will come in with a toothache is that they have a large area of dental decay or a cavity. So kids will get cavities from time to time for a variety of reasons, but most of it has to do with bacteria producing acid that eats your teeth away. So if you have a cavity that's causing a toothache, typically what that means is that the cavity in some way is affecting the nerve which sits in the middle of the tooth. So if you have a cavity or your child has a cavity that's that large where it's affecting the nerve of the tooth which sits in the center of the tooth, the first thing that you want to do is try to clean out the area where the cavity is. And when I say clean out, I mean with dental floss, with a toothbrush. Just try to get the area as clean as possible, preferably with a fluoridated toothpaste. Once you've cleaned the area out, a warm saltwater rinse is also typically going to be helpful. And if you're able to do that warm saltwater rinse and get some relief, that's great. If you're not, then again, over-the-counter pain medication is going to be the best thing to use until you're able to get into a provider and make sure there are no issues. Those are the two big reasons that kids will come in with toothaches. There are other reasons, but they're numerous and they are a little bit too much for just a short video on why kids typically have toothaches. So what I'd like for you to do is take your child in if you feel like it's neither one of these issues, or if it is one of these two issues, take your child in to see their pediatric dentist or to see their pediatrician, just to make sure that you have a better understanding of what's going on and they can go ahead and provide the necessary treatment. Thank you, and I'll see you next time.